Hello, everybody. I want to welcome you to the Resident Family Support Council meeting. That the Ombudsman, the Illinois Long-Term Care Ombudsman Program conducts on the second and the fourth Tuesday of every month. We bring topics to you that we feel are important for people that are navigating the long-term care path, will find useful while they're trying to really make sure that they're getting all the information that they need so that they can live that good life while they're navigating this long-term care pathway, which can be very, very overwhelming at times. And like I said, we have these meetings on the second and the fourth Tuesday of every month at 3 o'clock. And we have the same link for every single meeting. So know that the meeting that you used for today's to get into today's meeting is the same link that you will use all the time. So please do feel free to share that link with everybody and anybody so that they can get the really useful, amazing information that we discuss during these meetings. I also just want to remind everybody that we do record these meetings and then we put them onto our YouTube account. And I know we've got Stephen here who works with the state office as well. And he is starting to put all those links into the chat so that you can access any of the materials that either get shared today and or the links to be able to connect with us through the Ombudsman program, as well as to be able to access our videos that we have recorded. We are probably, I think we're about 70 recordings now. So we've been doing this for 3.5 years, which is wonderful. Before we begin today, I do just want to give a little bit of a plug for our next meeting, which is going to be for Residents' Rights Month. Those of you may not be aware that October is Residents' Rights Month. And this is a time for us all to be reminded that everybody who lives in long-term care has rights. And they do not lose any rights. You do not lose any rights when you move into a long-term care community. And we're going to be talking about this. Stephen's actually going to be doing that presentation for us. And we're going to be talking with some volunteers as well, who have some really great ideas about different things that they're going to do to help celebrate this month. And we want to make sure that everybody comes to this meeting because this is something that each and every person that will be at that meeting will be able to walk away and say, I can do this to make sure that people who live in long-term care, including myself or my loved one, really understands that I've got rights and I should be able to live that empowered life that I deserve to have. So with that all being said, one of the things that's really been important to all of us is to stay healthy. And I don't know about all of you, but I am at a place where there is so much that I hear. We got so inundated with all of this information during the pandemic. Then I kind of went on a little too much information and got to a place where there's information overload. And we kind of got lackadaisical. And we did have another surge of the COVID-19 that has been going on. I know a lot of people have been getting it. And I will tell you that I am actually one of those people. I had it a week and a half ago. I wound up getting COVID. And I had to look up what it was that I needed to do because I have not stayed on top of it like I had stayed on top of it. So we're going to be talking today about these communicable diseases that before COVID even came around. So this is nothing new. The wintertime can be a very prominent time of year in long-term care where people do get sick. So we thought it's really important to bring the people in the know. So we have Renee and Yvonne here today from Illinois Department of Public Health. They are both infection prevention coordinators. And so they're going to be sharing with us how we can stay safe this season, making sure that if we're visiting, if we live there, if we're even somebody who just goes in and out as a provider for care, a consultant or anything like that, how we can make sure that we're doing right for the people who live in our community. Renee and Yvonne, do you guys just want to say hello and share a little bit about who you guys are?
Sure, absolutely. My name is Renee Chenor. I am the infection control coordinator for the Rockford region.
Great. And then Yvonne? Yvonne, you might be muted still. We can't hear you. You're muted. Yvonne. There we go. Yvonne. She forewarned me. She said they've been having computer difficulties. So Renee and Yvonne forewarned me. Yvonne, you're muted again. So we got to get your microphone unmuted. There we go. It's unmuted. Now let's see if it sticks. We are not hearing you. And ironically, Yvonne just tested with me before we began, saying, I want to make sure you can hear me. And here we go. These are the things that happen, right? Whenever we have our virtual meetings like this, we've all been used to it. And we all understand that this is just the nature of the beast now that we've become more being able to communicate with each other through these wonderful mediums such as Zoom. Yvonne, we're still struggling. We're not hearing you. Renee, are you prepared to do the presentation if Yvonne cannot get herself unmuted? She is unmuted. Yvonne, you are unmuted. I can tell you that much, but we're just not hearing your microphone.
Yvonne, you may want to check your settings to make sure that you are on your computer speakers and not your headset.
Yeah, we did. She did check with me as we were had the prelude to the meeting, and I could hear her then.
We were having some issues. I can go ahead and start.
Okay, I'm doing I have the presentation here, so I can go ahead at least, and I can get that happening. So let me pull that up. Okay. Hey, can everybody see it? We all good?
Yes, can you present it as the slideshow, please? There you go.
Like this. You got it?
Yep.
Can you hear me now?
Yes, Yvonne, we can
Oh
hear
my
you.
gosh. Sorry, I'm Yvonne and I'm here.
Yay, Yvonne. We're very glad that you could join us. Do you just want to share about who you are?
Yes, sorry. Last few days I've been having so many computer problems and they did a new download. So I think that's the problem. But I am in Southern Illinois is where I'm located, and my region as an infection prevention coordinator is the Metro East. So I normally deal with any like communicable diseases or congregate setting type diseases, which includes long-term care settings. And that's the Metro East. So it's like the 17 counties surrounding, like on the Illinois side, but near St. Louis.
Got it. Okay.
Renee is going to start and then I'll chime in later.
Okay, perfect. And then Renee, if you just want to tell me when to advance the slide, I will go ahead and do that.
Will do. Okay. So let's go ahead and get started. Good afternoon, everyone. Let's go on the first slide, please.
Am I at the first?
The title slide. Title.
Yes, I'm going to get there. It's okay. There we go. Okay.
Nope. First slide, IDPH slide. There we are.
Yeah, we have a little bit of a delay. Yeah.
Yeah. Okay. Good afternoon, everyone. Thank you for joining us for the presentation, Responding to Respiratory Illnesses in the Long-Term Care. My name is Renee Chenor. I'm the Infection Control Coordinator for the Rockford region. I cover 11 counties in Northern Illinois, North Central Illinois. I'm joined by my colleague, Yvonne Overton. She is the Infection Control Coordinator for the Metro East, as she had mentioned, on the Illinois border of St. Louis. Although this presentation will focus on respiratory illnesses within the long-term care setting, this information is useful for all community members. The presentation will discuss the burden of respiratory illness and the consequences of illness. What are the populations or groups of persons at high risk for illness? What are the respiratory illnesses? What are they? What are we talking about? How are the respiratory illnesses spread? And most importantly, what are the measures we can take to protect and prevent further spread? Next slide, please.
No,
Okay,
there seems like there's a bit of a pause, Renee, between me doing it and you
Okay.
getting it to you.
that's
So
fine. Okay. Okay. Viral respiratory season is rapidly approaching. The time is now to plan, protect, and prevent. Each year in the US, respiratory illnesses are responsible for millions of illnesses, hundreds of thousands of hospitalizations, and thousands of deaths.
Mm.
Anyone can become ill from respiratory illnesses. The severity of illness can range from mild to severe. Symptoms may range from a mild cough to more severe symptoms, such as pneumonia, resulting in hospitalization and even death. Respiratory illness can lead to more chronic or severe complications and or exacerbate existing respiratory conditions. Respiratory illness may cause pneumonia. This is a deep infection, either caused by the virus and or a bacterial deep into the lungs, the base of the lungs. Also result in bronchitis, sinusitis, ear infections, and or hearing problems in children, and worsening of chronic conditions such as asthma, COPD exacerbations, or even a secondary superimposed bacterial infection requiring antibiotics, to name a few. However, I must stress that if at any time that symptoms worsen to the point that there is difficulty breathing or you have chest pain, seek medical attention immediately. There are some groups of people or specific populations that have underlying risk factors that increase their chances of getting very ill or very sick, severe illnesses. People with existing or underlying respiratory or lung conditions that affect lung function and respiration, such as asthma, COPD, lung cancer, emphysema, cystic fibrosis, or use tobacco, are at a higher risk of acquiring respiratory illness. Older adults, their immune systems tend not to work as well and are more likely to have underlying health conditions, or they live in congregate settings. Young children, their immune systems are still developing and they have small airways. People with weakened immune systems have lower defenses because infections and their bodies may have a harder time building lasting protection from immunization or prior infection. Immunocompromised people, either because they have a medical condition or they are receiving immunosuppressive medications or treatments. People with disabilities are more likely to have underlying medical conditions, live in congregate settings, or experience factors and conditions stemming from social determinants of health that increase their risk for poor outcomes from respiratory infections. And pregnant and or recently pregnant people, because pregnancy can cause changes in the immune system, heart, and lungs, and make people more likely to get very sick from respiratory illnesses. Next slide, please. First, let's talk about respiratory illness to gain a better understanding and the rationale behind the protection and prevention measures. The typical respiratory season is from October 1st through March 31st. However, the season may extend longer if there is a high prevalence of a specific respiratory virus that is circulating throughout the population or the community, or if there's a high activity within the community and or a high sustained community spread. There are several different types or strains of respiratory viruses that can circulate more heavily in the community during the fall and or winter months. Why is that? Sunlight or UV power is weakened. Sunlight is not as intense or direct during the fall or winter months as it is in the summer. Sunlight and UV light destroys viruses. So if the UV light is weakened or there is no UV light because we have cloudy days, this allows the viruses to flourish. Viruses thrive in cooler, dry, and low humidity weather environments, as which we experience in the winter months. The colder temperatures lead to decline in the immune response elicited by the cells, and the nasal cavity to the viruses. The nasal cavity is the most common entry point of the viruses into the body and or respiratory system. Human behavior. When it's cooler outside, we move indoors. We spend more time, we communicate and have large gatherings, football games, whatever have you. We do more travel, either through airports, trains, planes, and let's not forget the holidays, where we're sharing the love with everyone. Next slide, please. How do respiratory viruses spread? Respiratory viruses spread from person to person through the respiratory droplets via direct or indirect contact with these infectious droplets. When someone is ill or infected with the virus, when they breathe, cough, or sneeze, the infectious droplets are expelled into the air. When an ill person sneezes or coughs, these droplets are expelled through the air from anywhere from 3 to 6 feet. These droplets can stay afloat and travel through the air from the infected person, thus contaminating the air. The heavier droplets can settle out of the air and land on surfaces, therefore contaminating objects and or surfaces within the environment. Now, viruses can survive on inanimate surfaces for hours to days, depending on the virus. Direct contact. When an ill person breathes, coughs, or sneezes, the infectious droplets that are afloat into the air are then breathed in directly into the lungs of a well person, or the afloat infectious droplets can land directly into the eyes, the nose, or the mouth of the well person. Indirect contact, occurs when you have contact with a surface or an object that was contaminated by those heavier droplets that settled out into the air onto the surrounding surface or objects into the environment. You have contact with these contaminated surfaces. You then touch your face with your contaminated hands, and this gives the virus an opportunity to enter the point into your nose, your mouth, or your eyes. So you self-inoculate by contaminated hands. Next slide, please. Perfect. This is a graphic demonstrating how respiratory illnesses are spread. Again, depending on the virus, COVID or flu, it is estimated that one ill person can spread a respiratory illness ranging from 2 up to 6.6 others. So think about that for a moment. You have one ill person that can spread it to 6 other people, and then those 6 other people then spread it on to another 6 people, and then another 6 people. So it can spread at a log, which is called a 6 log, and meaning that we can have spread very rapidly within the community. Again, it depends on how strong the virus is and what the virus is that's causing this disease. Ill persons in the population, those that are indicated in red, breathe, cough, or sneeze. The cough or sneeze, again, will travel through the air anywhere from 3 to 6 feet. The lighter infectious droplets can stay afloat into the air. This infectious air can then be breathed in directly into the lungs of the well person and or are deposited directly into the eyes, the nose, or the mouth. This is direct contact or direct spread. Again, when an ill person breathes, coughs, or sneezes, the larger, heavier infectious droplets settle out of the air, contaminating surrounding environment, surfaces, and objects. Again, depending on the virus, depends on how long that these viruses can survive in the environment, anywhere from hours to days. The hands become contaminated after having contact or touching the contaminated surfaces in the environment. And then again, touching your face and self-inoculating and giving the virus an entry point into your eyes, your nose, or your mouth. Next slide, please. And this is a graphic demonstrating when the virus enters into the nasal cavity. Once the virus enters into the nasal passages, lungs, or respiratory system, etc., it invades the tissue and begins to multiply. The invasion of the tissue then causes inflammation of that respiratory tissue, which then affects the lungs, the respiratory and or breathing, which is your exchange of oxygen and blood. The inflammation or the invasion of the respiratory tissues then becomes inflamed or swollen. And this is when you're going to see the onset of symptoms to occur. The most common symptom is the cough. Symptoms may be mild to severe, again, depending on many factors as mentioned before. Again, dependent on the virus and the severity of symptoms, these can lead to exacerbation of existing respiratory conditions and severe illness, resulting in hospitalization and possibly death. Next slide, please. This is a colorful slide. There are several different types of strains or respiratory viruses that can circulate more heavily in the community during the fall and winter months. The respiratory viruses indicated here in white, such as the rhinovirus and the seasonal coronavirus, these are your common cold viruses. You also have a virus called Parainfluenza, human metapneumovirus, Bocavirus, Adenovirus, and among others. These are not just limited to these viruses. You can have at any one time as many as 15 to 20 viruses circulating all throughout the respiratory season. These viruses tend to have milder symptoms, milder illness, and are self-limiting. Common symptoms of these are cough, fever, nasal congestion, sore throat, runny nose, headache, and shortness of breath. Treatment is usually supportive care and can be managed at home. Most people will recover from infection with rest, plenty of fluids, over-the-counter painkillers, decongestants, cough suppressants, and nasal sprays. Your health provider can test and identify what virus is causing your symptoms. However, there are no treatment for these common symptoms, except for the supportive care, as I mentioned, and there are no vaccines available for these viruses. However, now we're going to focus on the respiratory viruses here that are in red, okay? Such as COVID, influenza or flu, RSV, which is respiratory syncytial virus, and pneumonia, which can be either viral or bacterial. And we will discuss more in detail later in the presentation. A new term will be used for this season by the medical field to reference these group of viruses collectively. Again, this is going to be flu, RSV, and COVID, and it's going to be known collectively as pan-respiratory. The CDC has written a guidelines, which is going to be called Respiratory Virus Guidance, which is going to be applied as a pan-respiratory approach into a broader response in how to address these respiratory illnesses. And that will be forthcoming by the state later, probably, I would say, beginning of October. Those guidelines will be released for the Illinois Department of Public Health. Next slide, please.
And Jessica, you said pan, P-A-N, respiratory diseases?
And yes, that means that there's more than one.
Okay, got it. Just wanted to make sure I heard that properly. Thank you.
Yeah, it's going to be collectively known as PAN, which is going to be a group. They're going to be grouped together, meaning influenza, RSV, and COVID.
Great, okay.
Okay. Why the pan respiratory approach? Focus and detail. Well, this is a picture indicating the different slides or viruses. These are actual electron microscope pictures that the viruses are magnified 1,000 times over to see the detail. And you can see that the structure of each one of these viruses is completely different. COVID versus influenza versus RSV. And down here on the bottom right-hand corner is a bacteria, Streptococcus pneumoniae, which is completely different. COVID, RSV, and flu are completely different organisms that cause respiratory illnesses, but they have common overlapping symptoms. You cannot tell by the symptoms alone what virus it is. You must be tested. They are the most prevalent respiratory viruses circulating in the community during the fall and winter months. They have the highest risk of burden of causing severe illness, hospitalization, and death. They are specific and/or common prevention measures to reduce further spread in the community. There's specific laboratory tests to quickly identify the viruses that's causing the illness. And then there's also, depending on the virus, there are specific antiviral treatments and/or therapies that are going to reduce your risk of developing severe disease and or illness or their complications. Most importantly, these viruses have vaccines that are available. The vaccines will prevent and or lessen the severity of illness through immunization. Next slide, please. This is just a small table and or grid that shows you that there are different organisms that can cause illness and have common overlapping symptoms. The symptoms of flu, COVID, RSV overlap, and they also overlap with the other respiratory symptoms that I had mentioned earlier. And they can also have symptoms that mimic or have people who have persons who have asthma and or seasonal allergies. These symptoms are also mirrored in some cases. So again, you cannot tell by symptoms alone of what viruses that you have, or if it's an allergy or that sort of thing. You will need to test. Next slide, please. Hey, respiratory viruses in older adults. Why prevention is important in older adults, those that are greater than 65 years young. As people get older, their immune systems do not work as well, and or they are immunocompromised. Older adults have defenses against infections, or lower defenses against infections. Their bodies may have a harder time building lasting protection from immunization or prior infection. Older adults may also be immunocompromised either because of the underlying medical condition or because they receive immunosuppressive medications or treatments. These medical conditions or treatments may result in moderate to severe immunocompromise, including but not limited to cancer treatment, organ transplant with immunosuppressive therapy, and primary immunodeficiency. Older adults are also more likely to have multiple underlying health conditions and or comorbidities, obesity, heart disease, kidney disease, COPD, and that sort of thing. Other older adults are more likely to live in congregate settings, nursing homes, long-term care facilities, and or assisted living congregate settings. Next slide, please. The burden of illness for COVID. Studies have shown that compared to people in the age group 18 to 39 years, people ages over 75 years are about 9 times as likely to die from COVID-19. This is due to the increase in incidence of chronic or underlying medical conditions such as diabetes, chronic kidney disease, COPD, neurocognitive issues, disorders, and heart disease, and others. During the 2023-2024 season, over 95% of the older adults hospitalized had no record of receiving the latest or updated COVID vaccine. Being up to date with vaccines is the most important means of protection for severe illness. Next slide, please. The burden of illness for flu. People 65 years or older are at higher risk of developing serious complications from flu compared to young, healthy adults. The risk is due in part, again, to the changes or weakening in the immune defenses with increasing age. While flu seasons will vary in severity year to year, season to season, during most seasons, people 65 years and older bear the greatest burden of severe flu disease. In recent years, between about 50 and 70% of seasonal flu-related hospitalizations have occurred in older adults for this age group, age 65 and older. It is estimated that between 70 and 85% of seasonal flu-related deaths in the United States have occurred, again, among this age group, 65 years and older. Next slide, please. Burden of illness for RSV. RSV is not a new respiratory virus. RSV can occur in very young children, ages 0 to 5 years, and older adults. RSV causes substantial mortality and morbidity in these age groups. RSV infections can be dangerous for certain adults. Each year, it is estimated that between 60,000 and 160,000 older adults in the US are hospitalized due to RSV-related illness. And 6,000 to 10,000 will die from RSV-related infections. Adults at high risk for severe RSV infection include adults 75 years and older, adults with chronic heart or lung disease, adults with weakened immune systems, adults with certain underlying medical conditions like severe obesity and severe diabetes, and again, adults living in those congregate settings, nursing homes, long-term care facility, and or assisted living. I am now going to turn over the remainder of the presentation to my colleague, Yvonne.
Next slide, thank you. So I'm going to talk specifically about influenza, COVID, and RSV. These three have the highest morbidity and mortality, but there are vaccinations available, and there are considerations for therapeutics as well as isolation and quarantine. Next slide. Influenza, commonly known as the flu, is a highly contagious infection of the airways that infects the nose, throat, and sometimes the lungs. It's often referred to as a seasonal influenza because these viruses circulate annually in the winter season in the Northern Hemisphere. The timing and duration of influenza season varies. Outbreaks and increases in activity can happen as early as October, but most often activity peaks in December or later. Late season outbreaks occurring in April and even May have also been reported. Some groups are at higher risk for developing a severe illness or complication, as Renee has just went over. Persons 65 years of age and older account for an estimated 80 to 90% of the deaths attributed to pneumonia from influenza. Next slide. Although many people call GI illnesses the flu to describe illnesses with nausea, vomiting, or diarrhea, these symptoms can be caused by many different viruses. They're even caused by bacteria or parasites. While vomiting, diarrhea, and nausea can sometimes occur when people have influenza, particularly children, these are not the main symptom of influenza. It is a respiratory illness. Next slide. Currently, for the US, we haven't really entered into a strong flu season. As you can see in this current map of the United States, it shows that we are in minimal illness. The green on the right shows all of the green levels are minimal, and then you can see across the US map, no one has really even reached the low levels. So we're still minimal. Next slide. For the United States, you can see at the beginning of this chart, it says week 40 of 2023. So that means October of 2023, last year's flu season. The colors just represent different variances of the flu, but what I want you to really focus on is that black line with the little dots, and you see how it rises and falls. What I want you to take note of is that the black line with the circles represents overall positives, and you can see how they peak. So that very first peak is December, and then it kind of dips a little bit, and then you have the beginning of the next year, which is January, February, March. And so we have a peak in December here, and we have a peak in like February, March. Next slide. This chart is comparing data from several previous seasons. So each line represents a different year. Just note that every year pretty much shows the peak. If you see how they all kind of rise in December, and then the two red arrows at the top I've used to kind of point out December and February. And so most every year has a peak then. And significant activity can last as late as May. That is why it's important that you get a vaccination in October, because it will protect you over all of these months. Next slide. Now this slide shows the months that the flu peaks. It starts out in 1982 and goes up to 2022. And what it has just done is combine the peaks of every season. And it shows you once again that December we have a peak, and then most years, February is the highest peak for the flu season. And we'll usually see most cases in February. So it takes about 2 weeks for protection to develop after you get vaccinated. And the flu vaccine typically provides protection for about 5 to 6 months. So it's recommended you get vaccinated in late September, early October to ensure that you're protected throughout the peak flu season, which again can last between October to March. Next slide. So let's talk about COVID-19. It is a disease caused by the SARS-CoV-2 virus, primarily a respiratory virus, but can affect more than the respiratory system. It can be mild or severe, and some people experience complications and even death. We can have long COVID, where some people experience symptoms that last past the acute illness. Older people and people with certain health conditions are at higher risk for developing a more severe disease. The following list doesn't include all the possible symptoms, but symptoms change with each new COVID variant, and also can depend on your vaccination status and your history. So those symptoms include fever or chills, shortness of breath or difficulty breathing, a cough, sore throat, congestion or runny nose, new loss of taste or smell, fatigue, muscle or body aches, headache, nausea or vomiting, and yes, COVID-19 can cause diarrhea. Next slide. So this is a graph just comparing the hospitalizations. The graph you can see starts out in 2021 and shows all of those high rate of hospitalizations, and then how they taper off. So, we introduced the vaccination, and by 2024, we're seeing very little hospitalizations. Next slide. While the majority of the population has either vaccine-induced or infection-induced immunity, or combination of those, the virus that causes COVID continues to mutate. So new variants continue to crop up. And this is how new immunizations will remain necessary to control the spread of COVID. The 2024-2025 COVID vaccine formula has the most current variant of COVID in the vaccine. And this slide, you can see On the left, it's April 27th, 24. That's this year. And you can see all the colorful column there. Those are the variants. And as you go through each column, you can see how they change. And then over to the right, August 3rd of 2024, just last month, you can see what the current variances were and how they've changed. Next slide. So this is another graph showing the variant proportions, so you can visualize how interesting the pathogen morphs into other variants. Renee and I like this slide because it's mainly because it's pretty, but again, to me, it makes a more visual effect of how you can see in the beginning the original strain, and then how it is just keeps changing into other variants. Next slide. So RSV, it's a respiratory illness caused by the respiratory syncytial virus that spreads through aerolization of respiratory droplets or contact with contaminated surfaces. RSV usually produces mild cold-like symptoms and usually lasts about 5 days. The COVID-19 pandemic interrupted the usual seasonal pattern of RSV circulation, and this was due to staying at home orders, masking, and a higher attention to hygiene. Over the past couple of years, RSV has returned with an earlier onset and a variable season duration. Again, it's not new. It's the common cold, and it may cause mild disease in healthy adults and older children. However, there is a cases where very young children, those under 5 years, and in older adults, RSV can cause substantial morbidity and mortality, which includes lower respiratory tract disease, hospitalization, and death. Again, as Renee had stated earlier, older adults, those over age 65, annually experience a 10 to 31% hospitalization with RSV, and they're admitted into the ICU. So for those admitted into the hospital with RSV, mortality rate is close to 8%. Next slide. Pneumonia is a lung infection, and it can be caused by many different bacteria, fungi, or viruses. Older people and young children and people with certain health conditions are at higher risk for developing a severe illness and complication. And we wanted to throw this in here because it can be a result of all of these that will turn into a lower respiratory tract infection. Next slide. And pneumonia, along with influenza, COVID-19, and RSV, has a vaccination that's available. So we want you to start preparing now for the coming season by getting your vaccines. The reason we encourage these vaccines they are attributed to protecting the vulnerable population against more severe disease, and they decrease hospitalizations and even death. Next slide. The influenza vaccine is for everyone, 6 months and older, pregnant people and adults over 60, and that's annual. And then for the COVID-19 vaccine, it's for every 6 years and older person. They should get an updated vaccine, and there's different ones available: Pfizer, Moderna, and Novavax. And then the RSV vaccine should be given to adults over 60, and it is a single dose, so you don't get that every year. You just get it one time. Next slide, please. With the pneumococcal vaccination, the CDC recommends this vaccine for children younger than 5 years of age and adults over 65. You'll see the numbers 15, 20, and 23 on these different vaccines for pneumonia. And that means there's 23 different strains of Streptococcus pneumoniae. So speak with your provider to decide what vaccine is best for you. Risk-based infections for pneumococcal vaccination may vary by patient age. The type of vaccine and the number of doses can also vary by age and vaccination history. Next slide. So a resident has a cough and a fever. Now what do we do? We're going to talk about infection prevention and control measures. Next slide. Stopping the spread of respiratory infections is the goal. So getting vaccinated with these vaccines we've just talked about is the essential first step. Good hand hygiene, proper social distancing, as in 6 feet apart, and avoiding large crowds, staying home if you're not feeling well. Continue to wear a mask if you're having a respiratory symptom, such as coughing or a sore throat. And last but not least, these respiratory infections are mostly airborne. So be sure to check your HVAC, open windows if it's possible to let fresh air in and stagnant air out. Next slide. You may see these signs on your family member's door. They are signs distributed by the CDC. They have pictures which show exactly what precautions to take before entering the room. These signs are for many different organisms, so they're not only used for respiratory illnesses that we are discussing today. The signs show hand hygiene should be completed before entering the room. Providers who will be touching the resident for medical procedures or personal care must wear gloves, gowns, and a mask. And the stethoscope that you see on the sign is meaning that dedicated equipment should be available for healthcare personnel. The green sign, which is droplet precautions, shows the mask and eye protection. As a family member, you would want to make sure you wear a mask. Facilities should have a supply of masks at the entry to the facility or outside the room. If you have any questions regarding PPE, please ask the charge nurse. Next slide. If you're a visitor to a resident in a long-term care facility who's positive for a respiratory virus and they are on isolation, you'll be instructed on what PPE to put on to protect yourself, but please ask for help. We ask that visitors go straight to their loved one's room and not linger in other areas if there's not an important need. We also want to remind visitors that they should just not visit it when they're sick. Next slide. To prevent the transmission of respiratory infections in healthcare settings, the following infection control measures should be implemented at the first point of contact with a potentially infected person. This is why a facility will post the signs at the entrance and outside the resident rooms to alert staff and visitors that someone is sick and to take precautions. Also, it reminds us to wear proper PPE. We talk about cough etiquette and masking. Next slide. So covering your cough is so important. And when we ask that you cough or sneeze into your elbow, that's called the Batman maneuver. And we use that a lot to even teach young children in schools, the Batman maneuver, so that it will actually stop the spread of those particles from your cough or sneeze, and they'll go into your elbow instead. And also use a mask if you're having respiratory symptoms. Next slide. When to wear a mask. So source control is recommended more broadly by the CDC, and I have the links in here in the slide, but we want to wear a mask when residents and staff on a unit or a facility are experiencing a respiratory infection outbreak, or a facility-wide during periods of higher level of community transmission for any of the viruses listed. Persons can choose to mask whenever they feel it's necessary, so going above and beyond what's recommended. Next slide. So now that we know you have symptoms, we need to test to see what you have. So if it's your family member as a resident in the nursing home or yourself, we're going to swab your family member at the facility to send to the lab.
Yvonne, did we lose you?
You hear me?
Now, yeah. Now
Oh,
we do.
sorry.
We
Okay.
lost it. Okay.
Oh,
Sorry.
That's okay. Did you hear me about testing?
No. We
Okay.
said, yeah.
Okay, so yes, so now that we know that someone has symptoms, if it is a resident in long-term care, we're going to have to test to find out what it is that that person has. So we're going to swab them and send that to the lab. And then once we get those results, we're going to know why they're sick and how we respond and how to proceed with care. Next slide. So therapeutics is another name for treatment, but you may hear medical staff say therapeutics. Your treatment is driven by your physician. For influenza, antivirals are given to those who are having severe illness and should be started within 48 hours of the onset of the illness. For COVID, outpatient antivirals are recommended for those with mild to moderate symptoms and who are at high risk for getting very sick from COVID-19. Mild to moderate symptoms means that they're not hospitalized, they're not requiring oxygen, or they're not requiring an increase in their home oxygen. And then for RSV, reminder that just RSV is very common. It is the common cold. It's been around for a long time, so it's not new. Antivirals are not routinely used for this, but most adults with RSV have mild or no symptoms. The only caveat there is some older adults or they have chronic medical conditions may have severe symptoms with lower respiratory tract infections such as pneumonia and require hospitalization. Next slide. Pneumonia can be a result of many different organisms, bacteria, virus, and fungi. It will be treated depending on the cultured organism and at the evaluation of the attending physician. Next slide. So finally, as we finish up, a reminder on stopping the spread through good hand hygiene, social distancing, covering your cough, staying home if you're sick. Family members of residents should check to see if there are any viruses active in the facility and consider whether they really need to visit. If the visitor has been having symptoms, then they should not visit until fever-free for 24 hours without taking any fever-reducing medicine. Next slide. Thank you so much for your time and attention today. It's been our pleasure to present this information about respiratory illnesses and how we can prepare for them.
That was wonderful information. I learned a lot. So thank you so much for sharing all of that. We can now open up for any questions. If anybody has any questions, please, you can either raise your hand or you can put them into the chat. But while they're, if people are formulating any questions that they may have or typing away, I had a couple. You know, you always hear about those people when you get the vaccine. Like I got, on Sunday, I got my flu vaccine and my sister-in-law got it with me. And then she texted me today saying, do you have a sore throat? I have a sore throat today. I'm wondering if it's because I got the flu shot. Can you address that? I know that has been something as a long-term care employee for years. People get sick right after they have it and, you know, gets dismissed. Or is there something that happens along those lines? Can people get sick from the vaccine?
I can go ahead and address that for you. Normally the vaccine are safe, does not cause disease.
Mm-hmm.
And what you may be having is a reaction from the vaccine actually waking up your immune response and reactivating to that vaccine. So in other words, it may show you symptoms of having a sign or symptom of that disease, but it's not causing you to get the disease. You're not going to get the disease from the vaccine. It's impossible. It's just waking up your body and saying, hey, what's this going on? You know, so it's your body trying to defend off that little bit of inoculum that's causing it to react and build antibodies to the vaccine. So most often what you're going to see with the vaccine, either if it's COVID, flu, RSV, or any other vaccine for that matter, is going to be soreness at the site of injection, maybe warmth. Some people do have a fever, a slight fever, maybe a headache, but it is short-lived. It will only last maybe 24 hours or so.
And Renee, I appreciate that answer so much because for years people are like, no, you just got it because you got it. That was just a coincidence. And so what you said makes so much more sense because you do hear people having very, very mild little things here and there.
And if
Nothing.
I can add to that just
Yeah.
very quickly, that
No.
also shows that your immune system is acting appropriately, that it's healthy, it's acting the way it should and responding to a foreign substance. So that's really a good sign.
I can't
And
wait to tell my sister-in-law.
yeah, and remember that vaccines, it's going to take about 2 weeks for your body to build an immunity and or antibodies, circulating antibodies to that vaccine or to respond to that vaccine. So again, you still want to follow if you have symptoms or if you have anybody that's ill and you just got the vaccine. Again, go ahead and separate and whatever have you, because you're still vulnerable
Mm-hmm.
for at least 2 weeks until your body has built that immunity in response to the vaccine.
That's really important to, I think, for everybody to hear that. Just don't be thinking I got the shot and immediately think, okay, I'm all good to go. That you may still, you're still in that window of being able to get whatever disease or illness that may be.
Yeah, Lee, that happened to me actually.
Mm.
I got the COVID vaccine, and then within like 2 days, I was exposed to it, and then I got sick with COVID in
Yeah, there
between
you
the
go.
2 shots.
Yeah.
But one thing that really stuck out to me, because one of the arguments I hear against getting any vaccine is that even if I get the vaccine, I'm still going to get sick. And obviously, there are other variants, but the statistic that was presented earlier, I think it was in relation to COVID, was that 95% of people who are hospitalized for COVID did not receive the COVID vaccine. And
Yeah.
that really stood out to me, because yes, you may still get sick with COVID, but your chances of getting so severe that you end up going to the hospital go down exponentially.
Mhm. Yeah, that was a great information to share. Yvonne?
I was just agreeing with him. That is correct.
Oh, great. I have another question for you because my brother-in-law, sister-in-law's husband, he always gets pneumonia. Like he gets it every year. And first of all, I didn't even realize there was a vaccine for that. So I'm going to encourage him greatly to get that because he is very much a believer in that. But I'm wondering, are some people prone to different infections over other people just because of the way they breathe, the way their lungs are, is there something along those lines or no?
Well, I will say that there's a study that's been done that shows that I would say about 50% of normal adults micro aspirate during their sleep.
Hmm.
And maybe, it could be depending on how he sleeps. It could be depending, we don't know what organism it is that his pneumonia is caused by. So he could be colonized with something. But oral care is very important in decreasing respiratory illnesses, especially if you consider aspiration. So, like brushing your teeth before you go to bed, getting those organisms out of your mouth is very important in long-term care as well.
That is something I've never heard before. I mean, we all know we should be brushing our teeth, and you just think it's for the dental hygiene, not for the other health that can go along with it. I've never heard that. So that's a very important piece. And in long-term care, we do have a tendency not to provide oral health like we should be.
Right.
So that could, yeah.
Another thing that you consider too, does he snore? And you have that exchange and or coughing and or that microaspiration that can occur while you snore as well.
Really? So that could be causing the pneumonia. He could be doing a micro.
Basically taking your respiratory secretions, it's coming up and then it's coming back, getting it back into your lungs. So microaspiration.
I am definitely going to be talking to him about that because he gets it every year and he's gotten it pretty severely. So that's very, very interesting.
And each person is a different machine. Okay. And they have underlying conditions and or illnesses that contribute. They smokers or that sort of thing, use any type of tobacco, because all of that does affect your lungs and the tissues. So everyone's a different machine. Everyone's going to react differently and, just have different signs and symptoms and severity, mild to severe, hospitalization, whatever have you. So it's just think of it, and everyone has a different machine, and they're going to react differently to the vaccines as well because of their defenses also operate differently.
And I think that's a great way to summarize today, is that we all have to take a look and understand who we are and be proactive in making sure that we are providing the care for ourselves to keep ourselves healthy. So thank you again very much, Yvonne and Renee. We so much appreciate you guys coming and doing this for us today. We thought the timing of it would be perfect because, as you said, October 1st is when the season really starts to kick in. So it's wonderful that we were able to have you. So thank you again.
Thank you.
You're welcome.
And
Thank you very much.
And at this point, I'm just going to go ahead. I'm going to stop recording, and I will leave it open in case anybody. Sometimes we have people that don't want to ask questions publicly. If I could figure out, they've redone. There we go.
Yeah, I'm not seeing